hear more and more that the patient, the maternal patient, decides if the fetal patient, her own baby, ever becomes a patient or has his or her life ended by abortion. And so we're seeing that shift in language that we're hearing in academic institutions. We're seeing it in the media. We're seeing it from medical organizations. And we really want to restore what our profession is all about, which is caring, having that unique ability to care for both mom and baby.
There's never been a time in AAPLOG's 51 years of existence that it was more important that we exist than right now. We can be effective within the pro-life movement in a way that no other organization can be. We were established as a special interest group within the American College of OBGYNs. That special interest group actually then quickly became the largest and remained that way until 2013 when AAPLOG dissolved the title of special interest group.
And so even though we've been around for 50 plus years, we formally became a second organization to be a different voice that no longer could speak within AAPLOG.
What we have seen over the last approximately 20 years is that AAPLOG, the American College of OBGYNs, are throwing aside sound medicine, evidence-based medicine in favor of this ideological agenda of abortion with no restrictions, no barriers, no limits whatsoever. And I see that being harmful not only to our patients, but to our profession.
I don't think a lot of practicing physicians are aware of just how bold AAPLOG has been regarding the blatant lies that they're telling related to induced abortion.
Our voices are so important right now because of the lies that are coming out of the medical field that are scaring people into supporting abortion when they otherwise wouldn't. That has spurred us on at AAPLOG to speak truth to fellow medical professionals and to speak truth to the culture that induced abortion is not healthcare. It ends the life of one of our patients, and it oftentimes causes significant harm for our other patient.
If we didn't have AAPLOG's voice, there would be one narrative, and that narrative would be that the direct and intentional killing of one of our patients is normalized in medicine.
With AAPLOG leading the charge, doctors can make a difference in this fight for life. We are speaking up louder and more boldly for the truth and for the lives of both of our patients. We're doing that by providing alternatives for medical students to go to life-affirming residency programs. We're doing that by actively seeking out ways to get the truth out there in medical journals, in the media, and in the court of public opinion, instead of people just being fed the false narrative that the pro-abortion lobby would like for them to hear. And we're seeing that that makes a difference. We're seeing wins in states now where doctors are speaking up. Our membership is growing. We are serving as an example to groups all over the world.
The one thing that gets me most excited about the future of AAPLOG are the actual doctors themselves who are waking up and starting a revolution and saying, no more, you do not get our profession. We need every single one of those voices out there, and AAPLOG is leading the way. AAPLOG is connecting individuals to the needed resources to be the voice for their practices, their hospital systems, their local communities, their states, and this nation.
We have plans in place to reach physicians and medical students in every state in this country to get them into their state houses, talking to their lawmakers, testifying about the impact of abortion on their patients, and continuing to spread the word to women out there who are facing unplanned or complicated pregnancies that we are there for both you and your child.
AAPLOG is an organization that gives its members courage. This isn't an easy battle. It's every day. Sometimes it feels like it's every minute. To know that there's an organization that is in the arena, in the battle, gives me great confidence to keep fighting.
We are the ones who represent true medical advancement, true medical science, and the way that medicine was meant to be practiced. We need people to join with us to help us mobilize and equip our physicians to go out and be a voice for life and a voice for change.
Hello and welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists. On this podcast, we bring on experts who can provide insights to you as a medical professional to help support your life-affirming practice and career. I'm Miriam Diallo, AAPLOG's Communications Manager, and the video that I just played is part of an exciting new campaign encouraging pro-life advocates and medical professionals to mobilize in support of life-affirming physicians as they forge a new path forward in medicine. Here to talk about this campaign and its purpose are four physicians who are at the forefront of this effort to transform the medical profession and our nation's culture. This will be a two-part conversation, the second half of which will be published next week. I'm here today with my two co-hosts for this podcast, Dr. Christina Francis and Dr. Susan Bane, whom I'm sure you recognize, as well as Dr. Chris Cirucci, who is the chair of AAPLOG's board of directors. Ladies, thank you so much for being here.
Thanks so much for having us.
Great to be here.
Good to join everyone.
Lovely. And the video opens with a comment from you, Dr. Francis. There has never been a moment in AAPLOG's 51 years of existence that it has been more important that we exist than right now. Dr. Bane, thought I'd get your thoughts about why that is. Why is it that there's never been a more important moment in AAPLOG's history than right now?
Yeah, I love that the video starts with that because it is so true. You know, when the three of us trained, we were taught in med school and in our OBGYN residencies that we took care of two patients, a mom and a baby, a maternal and a fetal patient, and that trusted care was the foundation of what we provided those patients. And that's going away. As a matter of fact, you hear more and more that the patient, the maternal patient, decides if the fetal patient, her own baby, ever becomes a patient or has his or her life ended by abortion. And so we're seeing that shift in language that we're hearing in academic institutions. We're seeing it in the media. We're seeing it from medical organizations. And we really want to restore what our profession is all about, which is caring, having that unique ability to care for both mom and baby. I also think that the people who believe the maternal patient's the only patient, they've truly infiltrated academia. And so we really care about the next generation of doctors, of healthcare professionals that are being trained. And now is the time to restore medicine back to life-affirming Hippocratic medicine. And I think that's why Christina's statement, Dr. Francis' statement is so true for today.
Absolutely, and it is very much a timely moment in our history for us to be putting out this video and to be starting this campaign, just given all that's going on. The video also does a good job of going through AAPLOG's history and our relationship with the American College of Obstetricians and Gynecologists, or ACOG. Dr. Francis, how has ACOG's position on the topic of induced abortion changed over the years?
Well, I think this dovetails nicely onto what Dr. Bane was just talking about why it's so important that at this moment we exist. I think that the contrast between the kind of healthcare that we represent as an organization at AAPLOG could not be more stark from the kind of healthcare that ACOG is now advocating for, which I think for all three of us who sort of grew up within ACOG, when we were in our training, that's very sad for us to see our, what purports to be our main professional society and the birthplace, pun slightly intended, of AAPLOG go so far towards the pro-abortion side that now, in fact, they ignore sound medical evidence. And so just, people saw in the video that history, but of course, AAPLOG came out of ACOG. We were a special interest group within ACOG. And when ACOG started, they, there were a lot of people who were pro-life within the leadership of ACOG, and they recognized that elective induced abortions had no place in the practice of obstetrics and gynecology. They allowed for what at the time they called therapeutic abortions, what we would now say a maternal fetal separation. So they allowed for ending pregnancies when a mother's life was at risk. But then we saw them just gradually move with the culture, honestly, which I think is an important thing to point out is that ACOG, along with many other medical associations, but on this issue, ACOG really is leading the way. They allowed themselves to be swayed by cultural tides as opposed to following the medical evidence. And that's what we've seen with them over the last 60 years. They just have become progressively more and more pro-abortion at the expense of good patient care, to the point where now they say that babies in utero don't feel pain until the third trimester, which every one of us who practices knows that that's not the case. We can have good academic debates over whether or not babies start feeling pain at 8 weeks or 10 weeks or 12 weeks. And there's good debate to be had about that. But the fact that they have doubled down and said babies don't feel pain until the third trimester, or saying that self-managed abortions, essentially abortion drugs being dispensed online without medical supervision, is safe and is good care for women, when every one of us knows that that's not the case. And so what we've seen is ACOG just really throw medical evidence out the window when it comes to the issue of abortion. And so we are providing, I think, a very stark contrast to that, to say we are going to stand not only on what's right ethically for our patients, but also what the medical evidence supports.
Yeah, those are some really important points, Dr. Francis, and it's good that y'all are sounding the alarm because those of us outside of the medical profession, or maybe who are in the medical profession but haven't been in it for very long, might just assume that ACOG has always been this way, or that that's just the standard line of thought for every medical professional or every OBGYN. But it's important to know that that's not necessarily the case, and that there is an alternative perspective, and that's what AAPLOG is trying to provide. So, Dr. Cirucci, Dr. Francis mentioned a lot of important points about what ACOG is saying about fetal pain, about mifepristone, the abortion drug, and things like that. Their messaging, as you guys have said, is very extreme. And what impact does that extreme messaging have on medical professionals as they try and serve their patients?
Yeah, thank you, Miriam. I agree with what my colleagues have said. When I trained too many years ago, ACOG was pro-abortion, but it was still okay to be pro-life. Like, you weren't, maybe that wasn't great, but it was okay to have a different opinion. Now it's moved from that to it's not okay, you're not a good doctor, you can't take care of patients if you're pro-life. As pro-life medical professionals, we believe, and we do have two patients, our mother and our baby. And as obstetricians, that's what we do. We take care of both of them. So to say that you can't, ACOG puts forth the messaging, the false messaging, that you can't take good care of women without abortion. And that is simply not true. And I think this is harming certainly other OBGYNs, and especially our young people coming up into medical school and residency. Clearly, before the Dobbs decision, no one misunderstood what an ectopic was or a miscarriage. They weren't abortions. No one thought that on either side of the debate. And now it's being pushed. People think they can't take care of women who are having an ectopic or miscarriage. This is clearly misinformation. And ACOG has not stood up to combat this misinformation. In fact, they've added to it with their statement about abortion bans being harmful. And so, yeah, we just have to stand up for what's true.
Yeah. And Miriam,
we have to take care of both of our patients.
Sorry, Chris. I just was thinking and adding on to that, because maybe some people who are listening or watching the podcast wouldn't be aware of this, because it's been a couple of years ago now that it happened. But it was actually about the day that I was taking over as CEO of AAPLOG. What a day to start. We were kicked out of ACOG's conferences, and they said to the media that the reason we were no longer welcome at their conferences. And this one in particular was important because it was a conference for medical educators. So the people that are educating the next generation of OBGYNs. And we were kicked out explicitly because we were pro-life. And then when we invited them to a debate at Duke University, they declined to engage in debate. And so I think that's also really important. Not only is it important for people to understand that this means that OBGYNs in training are not hearing any other narrative other than the pro-abortion narrative that ACOG is putting out. But also the lack of debate and the suppression of debate within medicine actually squashes medical advancement. That's the way that we advance our medical knowledge, is by challenging the status quo, bringing up new ideas, bringing up new evidence, debating that amongst medical professionals, and debating where the evidence leads us, and then potentially changing our practice if the evidence indicates that we should do so. But by not allowing that, ACOG is really staying in the medicine and the medical science of 50 years ago, of 1973, when Roe v. Wade was decided. And so, I think that's another important point to make, is that if we want to be on the cutting edge, on the leading edge of medical advancement, obviously the three of us believe that puts you solidly in the pro-life position if you're following the medical science. But at the very least, even if someone doesn't agree with us, they should agree that open, respectful, honest academic debate should be allowed to happen, especially on really controversial issues like induced abortion.
And I'd love to add to the question too, because I think one of the worst things that ACOG has done is this language guide that they have, because it impacts the professionals themselves, but it also impacts other organizations who are following their lead. So they literally say that we should not use the term heartbeat in the first trimester, or even viability or living. We should use cardiac activity. And in their guide, it says the reason is because during pregnancy, the heart is developing. They then go on to say we should not use the terms baby, unborn child, or preborn child. We should only say fetus or embryo. Well, embryo and fetus are correct scientific terms, but most of our patients are lay people. They're not medical people, so we use terms all the time for lay. So, for example, if somebody needs to take a pill under their tongue, I will say take it under your tongue. I won't say take it sublingually, even though I may dictate that, or it might be on the prescription bottle. If somebody's having a heart attack, I don't walk in the room and say, I think you've had a myocardial infarction. I say, I think you've had a heart attack. And the same thing when women call us and their babies aren't kicking as much. They say that. They say, my baby's not moving. They don't say my fetus isn't moving. So ACOG is truly trying to dehumanize the preborn child, the embryo, the fetus. And that is so against what our embryology textbooks teach us on the very first page of them. The other thing they're really trying to do, and Dr. Cirucci hit on this, is they're trying to expand the definition of abortion. They actually have a statement that says, and I don't have it in front of me exactly, but abortion care encompasses abortion care, miscarriage care, and palliative care, trying to say that all of those things are abortion care, when we know that, first of all, abortion and care should never go together, because the direct and intentional killing of an innocent human being is not health care. But then miscarriage, you've got a natural loss where the baby's already dead. That's completely different. And then perinatal palliative care is all about helping those families who have a potentially life-limiting diagnosis navigate that and have a birth plan, and just like hospice. And so to call that abortion care, it's absolutely ridiculous.
And even in the news, we're seeing the impact that this expanded definition of abortion has on physicians, let alone, their patients, the pregnant women, preborn babies. But even just thinking about physicians, we're getting stories every day about how confused physicians are about, in pro-life states, about whether or not they're allowed to treat women who are pregnant and facing pregnancy complications to save her life. all because, you know, they're claiming confusion because of the way that the abortion law is written. But surely ACOG's expansive definition of abortion, such that any pregnancy intervention counts, is surely contributing to that.
Yeah,
Absolutely.
Yeah. And just to clarify, I think there's a little bit of the confusion is because of the medical terminology. So abortion in the medical term means a loss before 20 weeks. So we would call a missed abortion a miscarriage that hasn't happened, a spontaneous abortion, a miscarriage that has happened, an induced abortion, what we think of now as an abortion. But these were medical terms. And no one ever thought a missed abortion, a miscarriage, was the same thing as what we now, when we speak of generally an abortion. And there was always clarity there. And it's almost like that's been hijacked to just confuse people more. A miscarriage, an ectopic, these are not abortions. And there is no state law that prevents women from taking, or doctors from taking care of these women. And so I just wanted to clarify, there are ways that those terms are used medically, but they don't. When we say abortion, colloquially, we're talking about induced abortion, and everybody knows that. So there's no reason to confuse the terminology.
Right.
Absolutely.
Well, Chris, do you remember right after the Dobbs opinion, we were on a big national webinar together, and it's when we were all just shocked at why they were trying to confuse the language. And you put in the chat, can we from the get-go just clarify we're talking about induced abortion? And it didn't get addressed. I mean, the people on there, which were some of the ACOG leadership, should have simply said, yes, Roe and Dobbs are all about induced abortion. We know that. We've always known that. But they didn't choose to do that. And that spoke a lot to me.
And this goes back to what Dr. Francis was saying. We should be able, even if we're going to disagree, vehemently disagree, we should be able to discuss something. We should be able to discuss research, evidence-based medicine. We should be able to agree on terminology. We should be able to, come together and have discussions. And we're happy to do that with ACOG, but we've been turned down several times. So.
Absolutely. And one last quick point I wanted to touch on, if one of you guys have thoughts before we move on from this topic of how this is impacting medical professionals. Just all of this messaging that you guys listed examples of is really sending a message to incoming medical professionals and medical students who might be thinking about going into OBGYN, but are actually deterred just by the very obvious hostility that ACOG is sending towards people with pro-life views. So do one of y'all want to speak a little bit more to that?
Yeah, well, I can speak to that. I think there's a couple things. One is that by ACOG and their allies within the abortion industry equating induced abortion with things that all OBGYNs do, like care for miscarriage, care for ectopic pregnancies, things like that. It is giving students and residents this false sense that all OBGYNs do abortions, when in fact we know that the opposite is true. Actually, pre-Dobbs and post-Dobbs, the vast majority, more than 3/4, in some surveys up to 93% of OBs don't do abortions. And so I think, going back to what we were just talking about, it's very telling that pre-Dobbs, ACOG never, to my knowledge anyways, tried to equate abortion with miscarriage care and ectopic pregnancy care. Once they had to sort of justify their position of advocating for elective abortion through all 9 months of pregnancy, I think they realized that's not palatable to most people. And so they had to then start equating it with things that everybody supports, of course, which is miscarriage care, ectopic pregnancy, things like that. So I think that's one thing, is it's giving this harmful false impression that induced abortion is part of everyday OBGYN practice, when in fact it's not. But on the flip side of that, the benefit of the Dobbs decision and the benefit of the fact that now some states have outlawed abortion, at least, for the most part, is that now pro-life students have these sort of sanctuary states that they can go to and practice in an environment where induced abortion is illegal, where they should feel less pressure to participate in those kinds of things. Now, there are groups like the ACGME, the accrediting body for residency programs, that are still trying to force that on residents, even in states where it's illegal. And that is something AAPLOG is actively working to try and change. But I think it is a benefit that now there are states where induced abortion is not a legal option. And so that can't be done in those states. And so now we really have these places where pro-life students can feel confident that if they go and train in those states, that they won't be doing abortions.
Absolutely. Those are some really important points. And I think we've covered a lot of topics, just showing how comprehensive the impacts of ACOG's messaging and just the pro-abortion medical culture is for the medical community. I think that'll close out our first part of this conversation. And in part two, we'll dive a little bit further into the impact specifically for patients, and then go a little bit more into what can be done about it, whether you're a medical professional, pro-life advocate, or somebody else. Thank you so much for listening to part one of this conversation, and we will see you next week.